I have been advocating on behalf of chronic pain patients for virtual care for a long time. And one of the meetings that I remember was in December of 2014. And I remember that one specifically because I was told that it was impossible. I was told that it was too impersonal. I was told that doctors would never accept this kind of technology. I was told that there wasn't the ability to maintain safe privacy and things like that. The reason why it stuck in my mind is because the day before, we emailed a wrench to the space station. We fixed the space station. And it was really hard for me to believe that we could fix the space station that way, but we couldn't work on fixing me with the benefit of virtual care. So since that time, we've continued working hard on pushing the system to begin to accept virtual pain care. When COVID came along, it was an exciting moment for us because it gave us the opportunity to see how it would work, how patients and doctors would respond, and really prove the value of virtual care, especially in pain management. Unfortunately, though, we were a little disheartened by the fact that it came so quickly. We didn't have an opportunity for doctors to spend much time learning about it, understanding it, developing tools to use it to the best of its ability. And I felt bad. It must have been difficult to kick into drive that quickly on a new technology. But I have to say, you guys did well. So our first slide, oh, there it is. Conflicts of interest, anything to declare, disclose? Absolutely not. Health Alberta is funded by no outside sources. We are made up of people with lived experience, and we all donate our time. The information that we have used for this talk was gathered by patients from patients who've experienced virtual care during the time of COVID. We asked them questions, we had them share their experiences, and we gathered that together to give you an insight from a patient's perspective. So how are patients feeling about virtual care? Well, it was interesting because the first thing that we heard is that they were feeling more relaxed, positive about their appointments. And that started very early in the appointment. Right out of the gate, in the first couple of minutes, they knew it was different and they liked it. Virtual care offered a connection that phone calls didn't. So in the past, we've had experiences with phone calls with a specialist or maybe with our doctor when something came up in the middle of the day and we didn't have a normal appointment. Patients said that that felt very impersonal. But when we had the ability to see the doctor's face or the nurse's face or the pharmacist's face or the specialist's face, that we felt connected and we felt heard. They felt that their appointments, their care, and their relationship with their provider improved. And there's some reasons for that we'll get into in a minute. But it was exciting to see that very quickly, out of the gate, without much practice, we were able to accomplish that. And it gives us hope for what we can accomplish in the future with a little bit of planning. And all of them were hoping that we would expand virtual care, that this would be something that more patients could access, that it would give us the ability to access resources that we wouldn't have been able to access otherwise. And it would give those of us who have to travel a long distance to get care the ability to get care more conveniently. Frankly, over and over, we heard that the addition of virtual care to pain management was the best part of COVID, which says a lot. So I know that often when we talk about virtual care, we talk about the convenience of not having to travel and the distance and things like that. But frankly, that's just a small part of why virtual care has been a benefit for chronic pain patients. Timing to get out the door. Doctors see us once we're at the office, but you don't see what goes into getting to the office. You know those patients that are always 5 minutes, 10 minutes late, or they come through the door huffing and puffing because they were just about late? It's not because they didn't try. It's not because they didn't want to be there on time. But quite frankly, brain fog is real. We often plan our trip from home to the doctor's office based on our best capabilities. So when we get out into the world and it doesn't go well, it tends to make us late. Perfect example. You get up in the morning and you intend to be dressed and at the door in 45 minutes. But this morning, you're hurting a little more. This morning, it's a little tougher. That 45 minutes took an hour. You go outside to start the car and you realize that the window has frost. You didn't think about that because, frankly, you had your mind so busy working on just getting out the door. As those few minutes add up, by the time you get to the doctor's office, you're 10, 15, 20 minutes late. Having the ability to not struggle with that kind of timing in our day, particularly on bad days, was really advantageous for patients. It changed our mental abilities and our emotional state as we entered into the appointment. Runaway thoughts and time to ponder. So while that's going on, if we are getting stressed and anxious because we recognize that we are running late and we feel that deeply and we're nervous about what people are going to think, all of a sudden we also find ourselves traveling in a car for 45 minutes without the distractions that we might have at home. That gives us time to think about all the times the conversation went wrong, all the times that we tried to talk about our inability to sleep and instead it turned to blood pressure. We begin to stress and worry that we might forget something. We wonder whether or not our doctor's in a good mood or in a bad mood. And that time to allow our brains to run free and worry and stress over this very worrying and stressful experience adds negatively to the entire appointment. Discomfort increases stress and anxiety. Now, we're already stressed and anxious, but for many people with severe pain, the process of getting ready can increase their pain to a point where it would be hard to function normally. Traveling in the car, the seats aren't necessarily designed for their comfort. Getting to the office and sitting in a chair in the office, I guarantee you those ones weren't designed for comfort. By the time the doctor walks into the room, we have increased our pain from what it would be normally at home. We have reached a point where our pain is high, our stress is high, our anxiety is high, we're frustrated, and there's less to distract us. We don't have the TV or the cat to let out or a dish to wash. Instead, we are simply sitting there focused on what's going on. And what's going on is stress and anxiety. Let's face it, when you walk in the room, that's what we are already experiencing. Stressed and anxious patients always result in stressed and anxious doctors. Virtual care can give us the ability to reduce those things. These appointments have the ability to be more positive and more productive for both the patient and the doctor, allowing us to also build a better doctor-patient relationship. So it was interesting because very early on, we heard that experience of virtual care was different from the very beginning of the appointment. And the way patients presented that to us, we didn't quite understand what was happening. So we had them explain how their appointments start virtually and how their appointments start in the clinic. And one thing that became painfully clear is that those first couple of minutes when you walk into the room with the patient, there is an awkward silence. You walk in, you say hello, we say hello. The doctor or the nurse or whoever it is sits down and immediately has to log into a computer. Now, are we supposed to keep talking? Because if you talk to me while I'm trying to log in, I will probably bite your head off. Is it rude? I don't think anybody has an answer for that. And while you are typing and you are looking at whatever it is you need to look at and finding the right file, we start to talk, we stop talking, we start to talk. We don't know what to do with that first 2 minutes. There is one other experience in which two people go into a room where one person wants to get information and solve a problem, in which there may be that kind of silence, that And that happens to be an interrogation. And the reason for that is that that kind of silence causes the anxiety and stress of the other individual to go up. It is designed into an interrogation in order to cause stress. Now, I'm pretty sure no doctor or medical professional intended to do that, but it has a profound impact. When virtual care started, doctors arrived at the computer. Now, you may be typing, you may be looking at the screen, but it appears that we're still making eye contact. And in that first 2 minutes, that awkward silence just sort of evaporates. That means that we begin without adding to the stress and anxiety of an appointment. It may seem small, but it had a profound impact on the patients we talked to. Eye contact is another thing that was really important to patients. Sitting in the room, looking at the back of the computer or looking at your ear, it just feels impersonal. But if we are sitting at the computer, it is designed to make eye contact. While I'm talking to you, I can see what my notes are. And very quickly, my eyes are back on you. We're not separated because eye contact can't be made through a screen. If I were to turn and talk to somebody over there, making eye contact over there while I'm talking to you, you would feel uncomfortable after a while. It would feel like I'm not engaging with you. By simply looking back and making eye contact, even through a camera, it changes the experience for patients. And quite frankly, it made them feel like they were being heard, like they had their doctor's attention. Phone calls fell short. We know that some doctors, instead of using virtual care, move to phone calls. And honestly, one of the things that we learn is that patients often feel like they need to demonstrate in order to be confident that they're heard, or they need to see your reaction to be confident that they're understood. Explaining our pain, explaining our experience isn't easy. And we're trying to explain it to somebody who's never experienced it. Those phone calls take away our ability to point. They take away our ability to respond to a look of confusion on your face, and it increases a sense of insecurity in the communications. So moving to virtual rather than phone calls had a huge benefit because we had those abilities even though we weren't in the same room. Excuse me. I've been wrestling with a dry mouth. Patients in their natural habitat. I have a cardiologist. I went into his office and the cardiologist told me that my blood pressure was unusually high. I immediately started explaining that I had a stressful day, that it's never that high. I take it at home. And he calmed me down and he said, "That's fine. That's okay. What was it at home?" I told him. And he said, "Well, then we're good." Because it's more important what my blood pressure is in my natural habitat when I'm out in the world, when I'm at home, than it is sitting in your office. Because frankly, I'm only going to be in your office for a very small part of my life. I'm going to be out there for the rest of it. The same is true for chronic pain patients in virtual care. One of the things that we heard, and then we asked other patients to try, was having appointments at times a doctor would never see us. If we have a period of time in our day in which we feel more exhausted, or we have a reaction to medication, or we flare somehow, you are less likely to see us in your office. But virtually, if I don't have to drive and I don't have to get dressed and get ready and go and put that energy in, it would be more convenient and more reasonable for me to book an appointment at that time so you can see it. You know, acute care in an emergency room, one of the things that a doctor has is the ability to see what the patient is experiencing. This gives our family doctors the same ability. We can demonstrate what is wrong. I can tell you that lifting this cup and turning it this way hurts right there. One of our patients, her doctor had her walk during the appointment. It gave them the ability to see how that physical output, along with talking, impacted her ability to breathe, her energy levels, etc. He got to be a part of it, and it was something that they normally wouldn't do in a clinic. But she took her phone and she walked up and down, and he got more information that way. This makes us feel confident that you're understanding us. And we're able to have an appointment with you and show you what we are normally like. Many patients ask us whether or not they should take the breakthrough medication because they don't want to be in the office looking worse than they normally do. But if they take it, will they look better than they normally do? This gives you an opportunity to see us where we're at most of the time. One of the things that we discovered is that moving to virtual care changed the perspectives we have in management. I am a chronic pain patient. I need a medical condition monitored and managed. On occasion, I need some diagnosis and treatment planning, but I'm not sick. And when we go into the office and we are doing vitals and doing blood pressure and taking my temperature and weighing me, it feels like I am being treated for an illness rather than being managed for a chronic condition. I get it. Sometimes those vitals are important, but why couldn't we do them at home? We can get blood pressure monitors. If you want my O2 stats, I can get a meter for less than $20. My smartwatch can monitor my heart rate. Okay, it might not be as accurate as yours, but the important thing is we know how much my heartbeat increased and how much it went down to tell you what was happening. When we do that, when I'm taking my own vitals, when I'm gathering that information for you, I suddenly become an active member in my care team. Instead of you doing it to me, we're partnering in this. I am giving you that information. That is my responsibility. And to be honest with you, it begins to foster a new perspective in how our relationship works. One of the patients that started doing this without even realizing it, started using this responsibility to become more responsible for managing what they were eating and what they were putting into their body, because frankly, it showed up in those results. Remember, if we are going to be partners, we have to have something to do too. Our hope for the future of virtual pain care. Well, let's face it, we need it to expand. We need more resources and specialists connected to a virtual system. We have people who are in areas where there is very poor access to these things, and they need access. We need access to education, mental health, and things like that that can be reached with virtual care easier than we can be reached by us getting in a car driving. We need better team communication. I would like my pharmacist and my doctor and myself to have a meeting at one of my appointments where we all talk, rather than my doctor talking to my pharmacist behind my back about things about me. If we work together, become a team, and we know that team approach usually does better with chronic pain. We would like to see that there be more access to a nurse or a doctor for semi-urgent advice. Should I go to the hospital? Should I wait? Should I make an appointment? Should I take that medication he told me to, or should I wait for 10 minutes? We can call HealthLink, but usually they can't answer those questions for us. We believe that if we could access a nurse or doctor by virtual care where we could see them, they could see us, it could give us the confidence to make some of these decisions and reduce the amount of time patients spend in emergency rooms. And lastly, we'd like to see these appointments become more efficient and with better communication. These few things that I've shared with you that we've learned about virtual care are just the beginning. There is so much more out there. I've watched tons of videos, listened to a lot of talks on different ways that you can use virtual care to diagnose, different ways that you could communicate, different ways to share files, et cetera, et cetera. The more work that we do now, the more valuable this tool can become to not only patients, but to the doctors and medical professionals who are treating us. After all, happy patient, happy doctor, happy doctor, happy patient. I have to say, our first trip down this virtual lane was definitely patient approved.